Hi everyone, my name is Mala, and in this video I'll cover 3 reasons why private sector solutions won't completely replace cuts to US federal government funding. For those who don't know me, I'm the former director of tech for social good at the Microsoft-owned company GitHub, and I also spent a decade designing tech tools for the United Nations and other international development organizations. As always, I have a few disclaimers. First, the opinions expressed in this video are strictly my personal views, not that of current, past, or future employers. Second, this video is strictly for informational purposes. And third, some of what I cover may be outdated by the time you view this. Already in the first 2 months of the second Trump administration, there have been massive staff, contractor, and funding cuts to the United States federal government. Now, literally no one I know is opposed to making the US government more efficient, and in fact, there are or were several government agencies that were tasked with exactly that, like the US Digital Services, 18F, and arguably CFPB, which consolidated consumer protection programs in one place. Other agencies like USAID had undertaken significant efforts in the past 2 decades to adopt digital technologies to better the quality, speed, and accuracy of their service. They also had robust mechanisms to track expenditures and measure impact, which were often much better than what many private sector companies use to track and cut waste. While the overall idea of bettering government efficiency is popular, there is disagreement about the ownership and method of those efforts. Now, I have my opinions about Elon Musk's Doge, what it's doing and how it's operating, and I'm sure you do too. But I don't want this video to be written off as political commentary, and I think the effects of this administration will far outlast the actual administration, so I'm not going to focus on specific people in this video. Instead, I want to look beyond any one government agency program at the idea that the private sector and its products, services, and solutions can adequately and completely replace federal government funding to provide the goods and services people need to live safe and healthy lives. And remember, I've worked for years in both the private and social sectors along many government agencies globally. This video is not meant to rank one sector as superior to the other. I see the advantages of all sectors and why they all need to work together. And that's why I felt compelled to make this video. 3 reasons why private sector solutions won't replace US government funding are corporate philanthropy versus federal allocations using Maslow's hierarchy of needs, productization versus the continuum of care, and markets versus populations. One of the obvious ways that private sector solutions can make up for lost government funding is through philanthropic efforts, which in big corporations are often done in one of these ways: through social impact or education programs, through an affiliated foundation, through direct cash contributions such as a donor action fund or DAF for short, and through corporate matching of employee donations. Most corporate matching programs double employee contributions to any nonprofit that meets basic conditions. I won't talk about employee matching since those donations are spread out over many organizations and most employees donate less than $1,000 a year. The bigger amounts of money that corporations donate are usually through the first 3: programs, foundations, and DAFs. Now, anyone who's ever been responsible for allocating these corporate donations will tell you there's a magic overlap to get it approved at the executive level and/or with the corporate board. And that is what is good for the business and what meets a social good need. There are other ways to make the case. For example, if an executive really cares about a cause that isn't directly related to the company's work. But by and large, corporate philanthropic efforts must be aligned to business goals to get any real funding. This is unlikely to change unless the private sector is legally compelled otherwise, or feels enough pressure from its major shareholders. An example of this overlap that has been extremely popular among corporate tech companies is skilling. Let's say, for example, there's a student enrolled at an undergrad computer science program. While she may learn the foundations of computer science in her university classes, there are topics or methods or software packages that her curriculum doesn't cover. This is quite common since academic syllabi tend to change at a slower pace than the skills people need to get an offer from a top tech company. Corporate tech companies have thus launched all kinds of skilling initiatives, sometimes in partnerships with nonprofits like Khan Academy, to fill tech skills gaps. Skilling initiatives are great for private tech companies because they can get early adoption of their products among students, create new business channels with universities, train the next generation of workers, and position themselves as a company that gives back to the community. While that can be great when done well and fairly, this brings us to a fundamental difference between most private sector philanthropic efforts and what federal, state, and city governments provide. The best way I can articulate these differences is with Maslow's hierarchy of needs, which you've probably seen if you've taken a psychology class. Maslow's hierarchy sorts human physiological needs like air, water, and food at the bottom because they're fundamental to survival. At the top are self-actualization needs, which can be thought of like becoming your best self. It's in this hierarchy that lies one of the major reasons why private sector solutions will not replace government funding. Meeting physiological and safety needs is simply too expensive. Let's look at our example with a computer science student. Yes, she may get supplemental education from corporate tech company skillings initiatives, but that company wouldn't have provided her entire education from the time she was a small child all the way through university. The foundation she needs in reading, writing, critical thinking, and math to even interact with the skilling program is far outside of the scope of what any one tech company would ever provide to any one person. What's more, the student may work for the private sector at some point after she graduates, but that employment and income are not guaranteed throughout her life, no matter how many skilling programs she completes. I would thus argue that corporate tech skilling initiatives meet the top two levels of Maslow's hierarchy, as they are designed to help candidates be competitive for a top pool of jobs, not meet basic employment and income needs to fulfill the bottom levels of Maslow's hierarchy. Some corporations do respond with funding and other support when there are one-off natural disasters or some other crisis that disrupts physiological needs. This often happens when a key geographic area is hit, for example, where a company is headquartered. In those cases, you might see a corporate social responsibility team organize a volunteer event to distribute meals and blankets to people who have lost homes in a hurricane. But even if private sector companies were to double and pool together their philanthropic contributions for any one cause, it would not be a substantial amount compared to what the U.S. federal government has spent in modern times to meet people's physiological and safety needs. That's why up until 2025, government programs like SNAP and Medicaid and agencies like FEMA that meet physiological and safety needs of food, health, and shelter cost hundreds of billions of dollars a year. And even those programs aren't available to everyone all the time. So are there ways to make government social safety nets that meet physiological and safety needs more efficient? Of course. That's one of the main arguments for universal healthcare and free higher education. But between the cost and not clearly contributing to business goals, private sector solutions will not systematically meet physiological and safety needs and will therefore not replace government funding. Two other reasons private sector solutions won't replace government funding are continuum of care and population coverage, which I'll talk about next. According to Statista, the life expectancy in the United States 100 years ago, in 1925, was about 58 years. Now it's about 78. One of the reasons for this 20-year increase is an idea called continuum of care. If you haven't worked or live in a low-resource area, this idea can be hard to visualize. Basically, continuum of care means that a person gets what they need throughout time and irrespective of their location to survive and thrive. This idea is often used in healthcare and housing. For example, when a baby is born in a hospital, a doctor or a nurse will make sure it's breathing, feeding, and moving correctly. If it's not, tests are done to figure out why. Care may be administered in case the baby has a complication. After the parents take the baby home, the baby should get checkups and vaccines it needs to avoid diseases and stay healthy. Getting the right healthcare, be it preventative, diagnostic, treatment, or support, at the right time helps ensure the baby grows into a child, into a teenager, and eventually an adult. Here's the issue. On its own, the private sector does not work under a continuum of care model. If you look at all the healthcare needs a baby has in its first year of life, the private sector can choose which products or services it wishes to offer. Due to high profit margins, a private medical device company might manufacture specialized equipment for young children to diagnose pneumonia. But that same company may choose not to manufacture a medicine a baby needs to prevent pneumonia because it won't make any money. A government may fill the gaps in continuum of care directly, or it may choose to subsidize the cost to a private company to do so. But on its own, private sector solutions do not have to provide a continuum of care. The productization of the private sector not only doesn't provide a continuum of care, but it can also be incredibly confusing for the average person to navigate. Think back to your childhood and what television options you had. Here in the United States in the 1960s, there were only 3 channels available. By the 1990s, consumers could pay to get cable TV or satellite. 20 years later, there were different cable packages and a handful of streaming services. Now we have an endless supply of streaming services: Netflix, Disney+, Hulu, Prime Video, YouTube, to name a few. If you want to watch a particular TV show or movie, you first need to figure out which service or product you have subscribed to that gives you access. There's a chance you'll have to buy yet another product to watch what you want. Even before federal funding cuts, the same thing has already been happening to the U.S. healthcare, and it is confusing. Here in New York City, someone can subscribe to a multitude of health apps for talk therapy, a delivery service for weight loss and hair growth medicine, an online service for dental insurance coverage, and concierge primary care boutiques. You can visit a pharmacy for some free vaccines or go to a travel clinic and pay for other vaccines. If you have an emergency, you can go to urgent care instead of the ER. Some of those are covered by traditional health insurance, some are subscription-based, and some are one-off costs paid out of pocket. Healthcare services have been productized because health insurance in America is expensive and coverage is piecewise. The rapid productization will get even worse without government funding. Imagine subscribing to a bunch of healthcare services only to realize during an emergency that you don't have access to the one thing you need, either because you didn't pay or no one provides it anymore in your area. That's the breakdown of continuum of care. And that's another reason why private sector solutions won't completely and adequately replace government funding. When I first joined GitHub in 2019, I was quite shocked to discover that the tech industry breaks up the entire world into only 3 regions. At the United Nations, where I worked before, there were 7 to 9 top-level regions. Moreover, everyone I work with could discuss in great detail about different language, ethnic, tribal, economic, political, and geographic subregions. Of course, GitHub and other private sector companies have more nuanced ways to talk about people than just 3 sales regions. The key difference is that the private sector talks about markets, as in groups of people, companies, or organizations, or even verticals that currently do or might want to consume the products it sells. The UN and governments, however, talk about people in terms of populations. The reason this distinction matters is because not everyone in a population might be part of a market. For example, a for-profit organic grocery store chain might do some customer research and figure out they should expand their operations to a neighboring state. However, their food products are so expensive that only people who can afford to shop there make $125,000 or more a year. Therefore, their target market is health-conscious consumers in top income brackets. That kind of market segmentation is fine for a private sector company. But the role of governments is to ensure the entire population, not just the high-earning market that can afford expensive products, is food secure. That's why food subsidy programs like food stamps exist. This is a critical thing to understand when it comes to populations. In every country in the world, there will always be people who simply cannot afford to buy or access market products. Some people are disabled and can't work, or can't afford to leave a depressed economic area, or they're a full-time family caregiver and they don't have additional income, or due to their immigration restrictions, they're not allowed to work. The private sector will continue to serve its markets that thinks it will turn a profit. Meanwhile, there must be a solution for the rest of the population that will never directly make the private sector profits. That's it from me on 3 reasons why the private sector won't completely and adequately replace US government funding. I honestly can't believe I felt compelled to cover this topic in the year 2025. Alas, as a new world order might be emerging, it's really important that as many people as possible understand the importance and the unique role of government. Now, before I leave, I should note I'm open to new full-time and part-time jobs, and I'm currently accepting speaking requests. If you're interested in working together, please reach out at malakumarconsulting@gmail.com or on LinkedIn. You can find more info about my work at malakumar.com. And lastly, if you like this video, please be sure to like and subscribe for more. Thanks for watching.